Spa, part of Sherway Gardens, and they have a separate entrance here. And I'm filling in for Lori this morning. We're all talking about the anti-aging show. That's basically been the trend since yesterday, right through into tomorrow. And the anti-aging show is coming up this weekend. So we're going to talk about Botox and fillers and things like that this morning. Maybe some of those things that some people are interested in out there. They have a lot of questions. So hopefully we can answer those questions for you a little bit later on. That is it for now.
Still on the health front, it's the International Anti-Aging Show. We've been there all week, and
yes.
We're there this morning.
That's right, and we're getting ready for the big show coming up this weekend. So I'm at PureMed Spa, and we're actually at one of their 12 locations right now at Sherway Gardens in the Etobicoke area. And joining me here today is the medical director of PureMed Spa, and you're Dr. Zell Krajden. And thank you so much for joining us here today.
Thank you.
Okay, so these types of med spas are really becoming the thing. Women are more interested in going in, and men as well, in touching up and doing little things here and there. And you guys have a lot of different services that you offer here. Let's talk a little bit about the PureMed Spa.
Oh, sure. So PureMed Spa is the largest med spa in North America. There are 50 locations in the United States, mainly on the West Coast and southern areas, and over 12 locations in Ontario.
Okay.
And it's the largest med spa, like I said, in Ontario, largest med spa in the United States. Provides a whole array of skincare, non-surgical and surgical consultation services.
So it's one of those places that someone can come and again get some of those things that they're so familiar with, and then also maybe delve into some of those little things like Botox or fillers that maybe they're not so familiar with. And that's what we're going to talk about today, some of those things, right?
So everyone knows about Botox, fillers, facials, chemical peels. There's other things that people don't know about.
Right.
When someone to a med spa like this, they'll meet with the manager, they'll meet with the physician, get educated about those services. One of those services is called DC lipo, which is a technique where you inject a chemical into small areas of fat under the chin and on the body to help dissolve the fat.
Okay. Now when a client's doing something like that, what can they do to help make this procedure that much better?
For sure. So it's a very safe, effective chemical. It's something naturally that's produced in your liver, secreted into your gut. It helps dissolve fat normally when you eat food. What you do is it's a very small, safe injection needle, very comfortable into those areas. Generally 4 treatments, each roughly a month apart, and helps dissolve roughly a centimeter of fat with each treatment. It's really not a substitute for diet or exercise.
Right. So you're encouraging people to continue their diet, exercise, and combine those two things together.
For sure.
So,
and as a plastic surgeon, it's also not a substitute sometimes for liposuction, tummy tucks, but it's a nice middle ground for certain people that have mild to moderate fatty deposits.
Okay. So throughout the show today, we're going to talk about, give us an example of some of the things we're going to talk about.
We're going to be talking about photofacial, which is a great technique to give beautiful skin, decrease pigmentation, fine lines, decrease enlarged pores. We're going to talk about some laser hair removal, safe, effective, great treatment.
Okay.
We'll talk about some Botox for fine lines and facial shaping. And finally, do some injections of lips, folds, and the jawline.
Oh, everything everybody wanted to know. Thank you so much, Dr. Zell. We're going to be back in just a little bit later on in the show, and we'll get right into all this again from PureMed Spa in the Etobicoke area right this time. We'll be back.
Yes. Hi, Leslie. What about you?
Well, my mom is watching.
I can't help with the swearing thing. But on the road to anti-aging,
Nice girl,
here
what a
again
mouth.
is Dr. Zell Krajden, and we are talking about the anti-aging show, which is coming up, of course, this weekend, starting tomorrow. And now we're talking about laser hair removal. A lot of people, this is something that's actually a lot of people can access.
Definitely.
Right? Yeah.
Laser hair removal was one of the first medical applications of laser light. It's very safe. It's very effective for permanent hair reduction.
Now, what areas of the body can you use this on?
Pretty much any area that someone wants treated can be treated quite effectively. Some areas more effectively than others, and most areas are treated quite nicely with 3 to 5 treatments of laser hair reduction. And occasionally people will need certain maintenance treatments for heavier areas.
So this can be meant for men or women?
Definitely.
Right? On face? Can you use on the face?
Definitely.
Okay,
Definitely.
interesting. So it's very safe.
For sure. I'd say probably about a quarter of my patients are male. Sure.
Oh, really? Okay.
Definitely.
Okay. So now we're to have our patient here. And what's your name?
Medea.
This is Medea, and we're actually just looking at arm because sometimes women like to just lighten up the arm,
For sure.
right, area.
Definitely.
So how many treatments roughly would we look at?
Average of 5 for good permanent reduction.
Okay.
I'd say a minimum of 3, assuming most patients will have 4 to 5. It can be used for all skin types, all hair types, and at PureMed Spa, with 12 locations in Ontario, we have a wide variety of systems for a wide variety of skin types to remove the hair.
Now, are there any sensitivities associated with this? Are you going to what are you going to feel during the treatment and then after the treatment?
Very minimal discomfort. It's a very comfortable, safe, effective treatment. Even patients with sensitive skin will say a little bit of minor discomfort that goes away within a few seconds.
Now, can you show us actually what the light looks like?
So
just so we can kind of get an idea.
quite a safe, small wand right here. It's applied directly to the skin in multiple passes. So across the areas over. Exactly. A little bit of gentle pressure, really not too bad at all. Small little bit of light goes in. The bottom of the hair bulb helps dissolve that little area.
Perfect.
Obviously, the larger the area, the longer the treatment
The more
takes.
work you need. Perfect.
Sure.
Well, you look pretty clean out there. That's good. So thank you very much for doing it. Thank you again, of course, Doctor. We are going to come back in just a little bit, of course, here at Pure Med Spa. I'm in a medical spa this morning, and we're dealing with the anti-aging show, which kicks off tomorrow in Toronto. So we're going to be talking about a treatment that you can do just to kind of fill in that nose a little bit in case you just don't want to get a full-on nose job. We'll talk about that. We'll be back.
Alrighty. 10 after 7 o'clock. We're getting a sneak peek of the International Anti-Aging Show. And congratulations to our latest ticket winners. And Leslie Stewart has the latest.
Hi, Leslie. Hey, guys. Well, I'm back with Dr. Zell Grajton, and he's actually a plastic surgeon this morning. And we wanted to make sure that people know that that's really what you want to look for when you're doing spa medical, right?
Definitely. For any type of treatment, you want to make sure that your physician or nurse is properly trained and properly credited for the injection or surgery that they're planning to do on you.
Okay. So we have a client here right now, and tell us what we are planning to do with this client.
So there's a new technique called an injectable rhinoplasty. Everyone knows the term nose job, and certainly a nose job is, I think, for some people to help improve the contours of the nose. But up to 75% of people don't like small appearances in their nose. They'd like something that's non-surgical, no downtime, to improve those minor irregularities.
Sure.
This is a technique that's been shown on The View in the United States. I use a temporary filler. It's safe, it's non-allergenic, and lasts roughly 6 to 12 months.
Okay. So
if you take a look at Samantha here, very pretty young girl, great skin tone. Good tip, if you look here, she's a very small little bump.
Just a little bump,
Yeah, and she doesn't want to go through a rhinoplasty, doesn't want to go through bruising, but she'd like a little improvement in that area. So she has a little bit of numbing cream that we put on just a few minutes ago. We use a very, very fine needle. And essentially what I'll be doing is taking that fine needle, taking a few small injections right up along here to really fill in that area and help camouflage it. It doesn't get rid of that bump that she has, but helps make it look a little bit more natural.
Smooth it out just a little bit.
Exactly. And this is the same product that I use for injecting lips, injecting cheeks, injecting jawlines. Very, very nice product.
And now, what is the actual product that you're injecting?
The one that I'm using is Restylane. It's made by a company, Medicis. There's many similar hyaluronic acid products in the market. One is called Juvederm, one is called TOCL.
Right.
They're all based on a sugar type of molecule that when it's dissolved in that 6 to 12 month time frame, usually closer to 12 months, this is broken down to sugar and water.
And then you just come back and you do it again.
Exactly, if they like the look. And the nice thing about doing a temporary filler is they come back, you can decide, take the photos before and after. Let's do a little bit more here, a little bit less here. And the actual patient can be an active participant in their care and their results.
Well, why don't we try just showing us exactly what you would do, and that way people can get an idea.
Side. Keep your eyes closed, stay relaxed. Okay, a little needle right in there. 1, 2, 3. Good job, honey. That's right in place. A little bit right there. She's doing beautifully.
So how does it feel to you? Just a little bit of a prick?
It is fine.
Yeah.
A little bit of a pinprick.
Yeah.
Very, very slow. It's one of the things, it takes 5-10 minutes. Nice, slow injection.
Okay,
and we'll come back later.
We'll come back in just a little bit and we'll let you finish up. And thank you very much, Doctor. We are going to take a quick break. We'll be back right after this.
7:53. All right, the International Anti-Aging Show kicks off tomorrow. We've been giving you a sneak peek all week long, and Leslie has more this morning.
Yes, I do, and I'm back with Dr. Zell this morning, and again, Dr. Zell is a plastic surgeon, but we're going through all the different types of treatments that are provided here, and we're going to do photo finishing now?
It's actually called photofacial.
Photofacial.
And what it is a technology based on laser light that helps to improve the quality of the skin. With age, there's the 3 Ds: deterioration, descent, and deflation. And what a photofacial does is it deals with the deterioration portion of that. It's a safe, effective, laser-based treatment. There's over 10,000 done in North America a week, and works really, really nicely for discoloration, brown spots, red spots, enlarged pores, and very nice fine lines.
So someone can look in the mirror at home and go, okay, I have a little brown spot here, I have a little, and come in and have a meeting with you. And,
for sure. And as a plastic surgeon, I do many facelifts. This is a great treatment for patients who are maybe a little young for a facelift. 30s and 40s, and patients who may be a little bit older who aren't getting ready to make the big surgical plunge.
Sure. Okay.
Very, very nice
So
treatment.
tell us what would happen when someone comes in for a treatment.
So someone
this.
like Karen would come in, she wants to deal with some very small irregularities in her face, enlarged pores near her nose and cheeks, and she'd come in. Full treatment takes about 45 minutes, very safe, very effective, quite comfortable. For anesthesia, a little bit of topical cream to help with discomfort.
That's something you take home with you?
Exactly.
Okay.
A little bit of redness for that day, and that's really just about it.
Oh, really? Okay. So if someone had a little bit of redness to their face, how many times would they come in to?
Usually you're looking at 3 to 5 treatments initially, and maintenance of 1 to twice a year.
Okay. All right. So, and now let's show us how this is done.
It's essentially nice handheld activator. Patient lying down nice and comfortably. It's applied to the face in multiple passes. Okay, each one very minor discomfort.
Just a little bit of...
Yeah, I mean, my wife just had one last week.
Yeah.
Was home half an hour later. Felt great.
So is this something you could do and then go out that night and you would notice?
Definitely.
Okay. Good to know.
For sure.
Wonderful.
Beautiful treatment, though, to really give perfect, nice, smooth skin texture.
Okay, so that could apply to a lot of people.
For sure. And like I said, as a plastic surgeon, I can deal with the descent.
Sure.
I can partially improve the deflation, but not the deterioration that photofacial improves.
There you go. Wonderful. Okay, thank you very much, Dr. Zell. All right.
Now we're going to head back out to Leslie Stewart. She's filling in for Lori DeAngelis this morning in Etobicoke. Hey, Leslie.
Yes, hello. Actually, I'm back with Dr. Zell Krajcin, and we have our patient back here, doctor, and we were talking earlier about instead of actually doing plastic surgery, again, a nose job as they call it, we did just a sort of a minor little prick here and there, and we have some magic results, right?
Definitely. So here's Samantha. She was our patient just from the last segment. Did a little injectable rhinoplasty with some Restylane. If you take a look here at the side profile, or we compare it to the other one, zoom right in, you can see a much more...
show our previous shot, then you'll be able to see...
Much more natural, smoother contour to the nose.
So we'll show the before, if we can get in a little bit closer. Probably be able to see it better at home from the distance they're at, but it's hard for us to see.
The overall contour of the nose, you come right in, you can see smooth, natural look. That bump that was present beforehand, smooth right out.
And what's the neat thing about this is that it's instantaneous. You can see the result. And when we could see it as you were putting it in, that it made the difference. And I could actually see it, so that was really cool.
Yeah, I know. She looks great, Samantha. How was your discomfort during the procedure?
It was very mild, very tolerable.
And you put a little bit of ice pack on there, and not bad. Yeah, it looks great. Looks really, really great.
Beautiful.
So a little bit later on, we're going to talk about some Botox and touching up fine lines.
Definitely. We're going to talk about Botox and fillers. Botox is a protein that helps smooth out fine lines, give a more relaxed, rejuvenated appearance to the face. In terms of fillers, it's a sugar that we use to help plump up deflated tissue, and again, smooth out fine lines, fill in furrows, and again, give the face a younger, more relaxed appearance.
Okay, wonderful. Well, thank you, doctor. And again, thank you, Samantha. We appreciate you getting down there and doing that for us. We're going to take a quick break, but we're also going to check our community calendar and be back in just a little bit as well here from Spa.
Leslie, one more time. She's filling in for Lori DeAngelis this morning. We've been giving you a sneak peek all week long. The International Anti-Aging Show kicks off tomorrow. Hey, Leslie.
Yes, it does. And we're at Pure Med Spa this morning in Etobicoke, and then of course it's attached to Sherway Gardens, just right by the 427 in the QEW. And I'm back here with Dr. Krajcin, and of course we were talking all this morning about the anti-aging show, and you guys are going to be at the anti-aging show, And tell us a little bit again about your spas. You have 12 in around the Southern Ontario area.
Yes. So I'm the medical director of Pure Med Spa. There are 12 locations in Ontario, over 50 in the United States. It's the largest privately or publicly held med spa in North America.
Wow.
And provides skin rejuvenation, injectable treatments, and consults for possible surgery.
Sure. Okay. All right. And you are a plastic surgeon yourself, right? So today we're talking a little bit on our last segment about fillers and Botox.
Yes.
And again, it's becoming more and more common. People want to do it, right?
Botox and fillers are both safe, effective, give a really nice result, help rejuvenate and relax facial skin lines.
Okay.
Botox is a purified protein. Takes 2 days to start to work. Lasts for 4 to 6 months in most people.
Okay, so then someone would just keep coming back every 4 to 6 months, get a little freshen up.
Sure.
And now, if you were to put in our patient here today, our lovely patient.
If we take a look right here, a few areas to treat are the wrinkles in here. Just frown for me. Come down.
And naturally, that just starts to happen with people, right?
So we'll do these areas in here for Botox, elevate the brow, give it a more youthful, awake appearance. Nothing too harsh. For fillers, fill in the lips, a little bit nice, full, luscious, younger look. In terms of the folds, fill it in, especially here near the nose. Help with that descent of the cheek, like we explained in the other segment.
Right.
The 3Ds, descent, deflation, skin deterioration.
Right.
deflation is really helped by fillers. And in her, a little bit of early pre-gelling that most people start getting, 30s, 40s, 50s. Injection here to help with that.
Wonderful. So there's lots of possibilities.
Yeah,
so someone can go by any of the Pure Med spas, have a consultation, and away they go. And
exactly.
help you out. Well, thank you. We really appreciate it again.
So nice to meet you, Leslie.
Dr. Zalkaj, and we appreciate you, and thank you coming in as well. And again, everybody here, all the staff at Pure Med, again, at Sherway Gardens, and of course, locations everywhere, so you can always log on to the website that was located on your screen. That is it for now. Let's go back to the studio.
Okay.